I'm Dr. Fred Lopayton from Dearborn Ear, Nose, and Throat. A little while ago, a DJ came to me and was complaining that his ear was blocked. He couldn't hear out of his right ear, but his left ear was doing pretty good. He didn't have any sudden problems. It's slowly over time that he noticed it. The first question I asked him is, does he ever put anything in his ear? And his first remark to me was, I use Q-tips to clean them. Well, there's the first problem. Q-tips should never be put in the ear. The earwax is a normal secretion of the glands. It actually protects the outer part of the ear. It only becomes a problem when it bunches up and actually blocks the transmission of sound. And then it's a problem. So pushing it in with a Q-tip is nothing more than a plunger. And when you're doing that, even if you're just going on the outside of your ear, you're still taking the wax and pushing it back in the ear. Wax works its way out normally. The body has its own way of cleaning out the wax by sloughing the skin and pushing the wax out. And as the wax goes out, debris goes out with it, whatever's trapped in that wax. Wax becomes a problem when you either use headphones, Q-tips, bobby pins, fingers, washcloths, or other things that wax kind of comes and collapses on itself. And then you have a big blob that is blocking the ear canal. And what we found on him was, as soon as I looked in his ear, there was a big piece of wax, and it was further down the ear, and it was past where the glands secrete. The glands only secrete up to here. His wax was down to here. Well, that meant something pushed it in, and it was probably the Q-tip. Now, he does wear some ear monitors, and that can do it. People who wear hearing aids can have it happen to them. And most of the time, people are using a washcloth or something else because they think they're doing a good thing by cleaning their ears, actually causes more trouble. Removing wax, you can use straight peroxide. You should be careful with water, especially if it has some contaminants, because you can get an ear infection similar to a swimmer's ear. But a few drops of peroxide usually will bubble out and release some of the wax. If the wax doesn't release and you're still feeling like you're plugged or your ear is itching and bothering you, you should look for medical help. An ear, nose, and throat doctor can actually, with different instruments, whether it's suction, whether it's irrigation, or whether it's manually remove, can actually see in the ear and easily remove the wax that needs to be. You don't have to remove all the wax. Again, that wax has a protective purpose. Just remember what your grandmother used to tell you, nothing small in your elbow goes in your ear, really rings true. I'm Dr. Fred Lopayton from Dearborn Ear, Nose, and Throat. If you need any further assistance, please look at our website at dearbornearnoseandthroat.com or give us a call at 313-582-8853. Thank you, and have a great day.